Welcome to Fundamentals of Person-Centered Dementia Care in Respite Environments. This training program was created by the Alzheimer's Association's Center for Dementia Respite Innovation and is intended for any staff member or volunteer providing dementia-specific respite care to adults in community-based care settings, as well as long-term care. During this training, we will cover the following topics: key components of person-centered dementia care, evidence-based practices to support individuals living with dementia in a respite environment, and tips for working with families to provide education and support. This information is intended to inform and empower respite providers supporting individuals and families impacted by Alzheimer's and other dementia. An estimated 6.9 million Americans are currently living with Alzheimer's. More than 11 million Americans provide unpaid care for a family member or friend with dementia. As the size of the U.S. population age 65 and older continues to grow, so too will the number and proportion of Americans with Alzheimer's or other dementias. Alzheimer's is progressive, and care needs will increase over time, meaning that caregivers will need additional support. Use of respite care by dementia caregivers has increased substantially. As the number of individuals living with dementia and caregivers increases, it's essential that respite services are available and accessible to those who need them. Respite care provides caregivers a temporary rest from caregiving, while the person living with dementia continues to receive care in a safe environment. Respite services may be provided for varying lengths of time and in a variety of settings, like in-home care, adult day centers, long-term care communities, or in community-based settings. The level and type of support provided will vary depending on the care setting, but a few examples include personal care or home health aid services, planned activities, or overnight care. Some respite providers are taking innovative approaches to meet community needs. This means that respite services may be provided in other settings not listed here. Respite care services can benefit the individual living with dementia by providing a safe, supportive environment, offering activities designed to match personal abilities and needs, promoting socialization and interaction with others, and enabling the individual to stay in their home for a longer period of time. For caregivers and their family members, respite care services provide an opportunity to rest, relax, or reconnect with others, time away for travel or to recover from surgery or illness, time to complete errands or personal care tasks, and a break to support and strengthen the ability to be a caregiver. Caregiving is an extremely difficult job. Respite care services can provide a feeling of comfort and peace of mind to caregivers and families, knowing that the person living with dementia is in a safe environment with other caring individuals. Person-centered dementia care is a philosophy of care that recognizes each person living with dementia as an individual with a unique life history and personal experiences. Care providers applying person-centered dementia care practices use an individualized approach to look beyond the diagnosis and consider the unique needs, preferences, and abilities of each person. This information about the person is obtained from the individual, family, friends, and the entire care team. Every interaction with the person living with dementia is an opportunity to gather more information and apply this knowledge when providing care. Consider your daily routine. How often do your personal preferences, likes, and dislikes influence this routine? What's most important to you? And what makes you unique? Providing person-centered care is more than just treating others the way you want to be treated. It's about treating others the way they want to be treated. Consider how this applies to the individuals you care for. What personal details would be helpful to know in order to make them feel comfortable, supported, and engaged? The key components of person-centered dementia care that are essential when supporting individuals living with dementia include value and respect the individual living with dementia and those who are caring for them. Regard people living with dementia as individuals with unique needs. Take the individual's perspective and connect to their current experience. Nurture authentic, caring relationships by building trust with the individual. Support ongoing opportunities for meaningful engagement. And create a positive social environment where the person living with dementia can build relationships and feel a sense of well-being. Now that you understand the components of person-centered care, let's take a moment to reflect. How could you incorporate these concepts into your daily work? A person-centered care approach has benefits for those living with dementia. It also has benefits for staff members who support them. Some of the benefits for the person living with dementia are increased sense of well-being, fewer behavioral symptoms. This reduces a need for medication to treat these symptoms. Lower rates of boredom and less feelings of helplessness, and lower levels of agitation. Some of the benefits for staff members are lower rates of stress and burnout, and increased staff satisfaction and capacity to provide more care. Next, we will review person-centered language, which is a critical component of person-centered care. The words and phrases we use to describe individuals living with dementia and the care provided can help to foster a more trusting and supportive relationship. For example, instead of focusing on the diagnosis or referring to someone as a patient, highlight the individual as a person living with dementia. Instead of emphasizing things the person can't do, consider what they can do. Help to maximize the person's independence by doing tasks with the person instead of doing for the person. Focus on connecting with the individual's emotions instead of correcting their perspective. Rather than labeling someone as a hoarder or wanderer, use person-centered language to describe the activity they are doing. And finally, understand that behaviors are a form of communication and should not be labeled as a problem or something to manage. We all have a right to express ourselves as long as it's not causing harm to others. Other terms like individualized care or client-directed care can also be used to describe this concept of person-centered dementia care. However this is described in your care setting, as long as you are providing care and support that focuses on the unique needs, preferences, and abilities of the individual you are caring for, that's person-centered care. In order for person-centered care to be most effective within a care setting, all members of the team must work together to put the person first. We will learn about the specific principles of person-centered care next. The following practices can help care providers implement the fundamentals of person-centered dementia care. Get to know the person. Connect in the moment. Focus on the relationship. Provide opportunities for meaningful engagement, and create a supportive environment. We will cover these practices in more detail in the following slides. The best way to get to know someone living with dementia is to engage with the person directly. Information from family, friends, and other members of the care team can help provide this knowledge. Knowing the unique person means that you have the information to support their unique needs. The process of getting to know someone is ongoing. As the disease progresses, needs and abilities will change, but likes and preferences may change as well. It's crucial to collect information about the person living with dementia, but it's also necessary to share this with others. Establish a process to share information and updates with staff and other members of the care team. Finally, take the time to understand the meaning behind certain likes or dislikes. We will describe how you can explore the why behind the what next. Putting it into practice. An initial assessment provides valuable information about the person living with dementia. Take the time to gather this information, even if the respite support you provide is brief. What can you do differently to gather information from your clients? Getting to know someone living with dementia requires gathering information about the person, but we have to take it a step further to figure out the meaning behind those details. Next, we'll hear from a dementia expert to emphasize the importance of getting to know someone living with dementia.
Getting to know someone is really more than just reading their likes and their dislikes. It's really about finding out about the why behind the what. For example, if you learn that somebody doesn't like dogs, it's really important to find out why they don't like dogs. I remember one lady, she didn't like dogs, and we knew that from her assessment, but when we were able to have conversations around it, we realized that she was bit by a dog as a child, and so she really feared dogs. And we knew when we would have pet therapy or bring animals in, it wasn't the right activity for her.
For individuals living with dementia, their sense of reality may be different from those who are providing care. In order to connect with an individual living with dementia, try to see the world from their perspective. Try to understand what or how they might be feeling and attempt to join their reality. Don't correct their comments or observations. Instead, join the person in their current state and focus on the emotion behind what's being communicated. Again, what they are seeing or experiencing may not be real for you, but their emotions are true. Don't judge or make fun of the individual. Let them know they are safe and that you are listening. Putting it into practice. Sometimes a person living with dementia may have difficulty adjusting to a new environment. Providing consistency and developing a routine can allow the overall adjustment to become easier. How can you improve your response to their new reality? For individuals living with dementia, the respite environment may feel unfamiliar and confusing. The following story provides an example of connecting in the moment during a stressful situation.
I remember when I was working in an adult day center, the end of the day always used to be a time where I knew people wanted to feel safe and secure. And I remember one lady was always distressed when the doorbell rang. You know, people were coming to get picked up, but she wasn't. And so we needed to think about how we could connect with the feeling that she was experiencing at that time of the day. So we would make her the helper. When the doorbell rang, she would come with us and answer the door, welcome people in, welcome people out, knowing that sooner or later she was going to go. When her daughter finally showed up, she was so happy to see her, and she knew that it was time for her to go then.
Care takes place within the context of a relationship, and relationships are a fundamental component to person-centered dementia care. In order to build a trusting, supportive connection with the person living with dementia, care providers should focus on the following. Know the person. This is key to connecting with the individual, building trust, and ultimately forming a relationship. Weave what you know into daily interactions. Live in the moment in order to connect with the individual. Focus on the emotions behind the words or actions and acknowledge how the person might be feeling. Put the person before the task. Instead of focusing on the to-do list, stay in tune with the individual and work to address their needs. Focus on doing with instead of doing for. Provide support to the individuals living with dementia to maximize their independence with tasks. Taking time to get to know the person living with dementia may impact your ability to manage other responsibilities. If you are having trouble completing necessary tasks, ask for help from other staff. Putting it into practice. Even if you are only providing care for a short period of time, you can still focus on building a relationship with the individual living with dementia. Taking the time to get to know what makes the person unique will help you connect. What small steps can you take to create better relationships with your clients? During the day, respite providers often have a long list of tasks to accomplish. The following example illustrates an approach to putting the person before the task.
I had to drive the bus for an adult day center and be involved in pickups and drop-offs. And I remember thinking, I could use that time to just accomplish the task and pick people up, or I could use that as a time to connect with people, talk about what they did the day before, or spend some time singing a song together. It was all part of thinking about how that time together can be a way to engage and connect rather than just complete the task of driving the bus.
Everything that happens in a day is an opportunity to engage the person living with dementia in a meaningful way. Provide support that is customized or individualized to the person's likes, dislikes, and abilities. Consider those activities that have meaning and purpose for the person. Activities and interactions should be both planned and spontaneous. Consider offering activities in both a group or individual setting. Always give participants a choice regarding whether or not they would like to participate, but understand that you may need to help them initiate the engagement. Finally, opportunities for meaningful engagement should evolve as needs and interests change with time. Putting it into practice. Even if an activity does not have meaning or purpose to you or family members, it can still be meaningful to the individual living with dementia. Be open-minded and observant about what the individual living with dementia enjoys, and find ways to make everyday experiences activities. How can you provide more opportunities for meaningful engagement throughout the day? Opportunities for engagement should not be one size fits all. This next example will highlight how activities can be adapted to meet the needs of participants.
Opportunities for engagement should evolve as needs and interests change over time. For example, an activity like baking can be adapted for individual needs. Let's say we're going to make muffins together. One person might only be able to help measuring the sugar or the baking powder, whereas somebody else might be able to actually use the mixer, whereas somebody else might just enjoy smelling the vanilla. But everybody can be involved in this grouped activity at their own level.
Creating a supportive environment within a care community requires inclusivity among staff, families, and individuals living with dementia to build trusting relationships and create a comfortable space for all to thrive. This requires that all members of the care team work together to support the individual living with dementia. Care providers focus on what the person can do rather than what they cannot do in order to create opportunities for success. Each person is recognized, valued, and respected for their differences. Accomplishments and occasions are celebrated. Individuals living with dementia have access to and opportunities for autonomy, engagement, and shared experiences. And finally, family and friends have the opportunity to connect with staff to share concerns or assist with care as appropriate. Putting it into practice. A supportive environment helps staff to find balance between providing person-centered dementia care and completing daily care tasks. Consider ways you can support other staff to complete tasks, take breaks, or address challenging situations. What can you do to support staff to fulfill their role within your own respite environment? A supportive environment encourages and validates the expression of individual, sexual, cultural, religious, and gender identities. The following story provides an example.
Individuals living with dementia can really benefit from having their self-identity recognized and supported. I remember one time in a discussion group, we were talking about spouses and families, and I knew that one woman was a lesbian and she didn't have the same experiences as everybody else. So I had to really think about ways that I could incorporate her identity into this conversation and talk about her spouse and her life instead of just talking about everybody else and their children and their grandchildren.
A supportive community understands the importance of the relationship between care providers, the person with the disease, and family. Consider the following ways to strengthen that connection to provide a family-centered approach. Listen to family and friends and validate what they are feeling. Often, caregivers need to feel understood and acknowledged for their difficult role. Provide education or information on Alzheimer's disease and dementia. For example, help family members understand that dementia-related behaviors are caused by changes in the brain and are not intentional acts of defiance. Use an individualized approach that meets the unique needs of each family. Instead of a one-size-fits-all response, tailor the education and support you provide to address specific needs or concerns. Offer opportunities for family members to share their questions or concerns with staff members. Consider scheduling a time during the week or at the end of the day when family members and care providers can exchange information. And finally, share information on opportunities for family members to connect with other caregivers or individuals who may share similar experiences. This could be through a support group or online forum. Putting it into practice. A supportive community recognizes the crucial role of the relationship between care providers, the person living with dementia, and their family. What additional strategies can enhance a connection to adopt a family-centered approach? Family and friends can provide helpful information to inform the care and support of individuals living with dementia. The following story helps to illustrate this.
I found it so helpful to really check in with families daily on an informal basis. At times, it really proved to be really essential to the care of the individual living with dementia. I remember one time, John was always a really good eater, but he didn't eat a lot during that day. And when his daughter came to pick him up, we let her know that he didn't eat a lot that day, which then was sort of a trigger for her to see maybe something else is going on. Well, it turns out that John really had a bad tooth that was giving him a lot of pain. And so by letting her know that he wasn't eating right that day, really gave her the information to then have that checked out and get that tooth fixed.
Providing person-centered dementia care is an ongoing process. Care providers should evaluate care practices regularly and make appropriate changes as needed. Consider the following actions you can take to incorporate person-centered practices into your respite care setting. Develop a plan. Consider how you will gather information about individuals living with dementia and how this information will be communicated with the care team. Create short and long-term goals for how to incorporate these practices into your care community. Include staff in discussions on providing appropriate support. Take small steps. Focus on the individual and what you can do today to support their individual needs, interests, and abilities. Get help if needed. Ask coworkers to help you provide appropriate support or suggest solutions to challenging situations. Recognize and celebrate accomplishments for applying person-centered care support. This concludes the Fundamentals of Person-Centered Dementia Care in Respite Environments training program. For additional education on person-centered dementia care, please review the Alzheimer's Association Dementia Care Practice Recommendations linked in the description below this video. The Dementia Care Practice Recommendations were developed to better define quality care across all care settings and throughout the disease course. They contain 56 recommendations across 10 different topic areas, grounded in evidence-based practices and person-centered dementia care, and are intended for professional care providers who work with individuals living with dementia and their families in long-term and community-based care settings. For additional information or support related to Alzheimer's and dementia, please contact the Alzheimer's Association 24/7 helpline at 800-272-3900. Thank you for your time and attention.